Well, welcome back to another episode of Specialness, a very special episode of Specialness. I'm Jeff.
I'm Kim.
And I believe where we left off last time was we were about to get some genetic testing.
Correct.
That was going to cost $26,000. If I can, before we get into the results, it was 2015. 2014?
2015.
It was 2015.
Yes.
Mid-2015, let's go with?
Yes.
So, at the time, $26,000 was still a lot of money, right?
Yes.
I don't know what the cash value of $26,000 is in 2025. Maybe we should look that up. But the point being, it was still strongly recommended that we do it. We were told insurance will probably pay for part of it.
Parts of it.
Parts of it.
Yeah, because this specific we'll get into this.
Yeah,
this specific genetic test that they were going to do is very new.
But the point is, we were going to jump into this with the possibility of it costing $26,000.
Correct.
And we wouldn't know until after we did it.
Right.
So we had that going for us.
Yes. Okay. So neuropsychologist referred us to a geneticist who ended up being a great guy. He's been doing genetics for like 30 or 40 years. Very well educated. I call, make the appointment, got the referral, and his secretary was like, okay, he wants to see, before he sees Cason, he wants to see all testing, any reports, school reports, everything. So, at this point, Cason's 13 and a half or so.
It's a big
huge folder. And I like that because then I didn't have to go in and be like, okay, so in this year we did this, it was like, here you go.
Sure.
So it took a couple months to get in to see him and finally go in and, like I said, great guy, calm man, looked at Cason and looks at me and he says, this is going to be interesting. He says, I have looked through everything. I've looked at all of his reports, all the diagnostic testing.
Which I thought was pretty surprising. I mean, I thought with a doctor, he would ask for everything, but he'd skim it.
Literally.
He really looked at it all.
He looked at it all. I mean, he was telling me information I'd even forgotten about, from when Cason was 4 or 5. And he gave Cason a physical exam and checked him out. And he looks at me and he was like, okay, in my 35, 40 years of doing this, I kind of have an understanding of kind of what we might see. And he says, I think we're going to see something with chromosome 15 because he has the autism and schizophrenia, schizoaffective bipolar, and the learning issues. And so I was like, okay, I don't know a thing about genetics. I have no idea. And that's when he tells me.
And there's a good chance a lot of people watching this may not either.
Right.
So 15, just to give a little background here, there are 23 chromosomes times.
I have no idea.
46.
I don't even know.
I think it's 23. And 15, obviously, each of those chromosomal spots on your chain develops some aspect of your genealogy, your physicality, everything.
Right.
And what we didn't know was why he suspected 15, but that was where he felt he was going to see something in the chain of his genes.
Right. So he that's when he tells me the cost of this, and I was like, oh, okay, but. Like he said, because your insurance will probably cover a portion of it, but not all of it because this part of it was brand new and insurance is not going to cover it. But just go with me. And I'm like, okay. At this point, we would really do anything to figure out what is going on with Cason. So he sent it.
Clearly we would do anything.
Right. So he sends us to get a tremendous amount of blood work. And at this point, Cason's very used to labs. He's become much better at it. It's not taking 4 and 5 hours.
He's kind of settled in now.
Right.
He's learned
to cope much better. He hates it, and he lets everybody know.
But up to this point, he still judges, blood tests by how many vials they pull.
Right. How many tubes?
How many tubes, right? And probably up to that point, the most tubes he'd ever had pulled was probably 5, 4,
Yeah,
5.
I'd say 5 or 6.
Which, it's not that that's not a lot of blood. And the vials are sometimes, there's small vials, there's large vials.
Right. But this was like 15. In case
was a lot.
Talk to him about it today, he still will tell you that doctor sent me and I had 15 tubes.
15 tubes.
But remarkably, he handled it really well. So the doctor said this is going to be about a 4-month wait because how extensive the testing's going to be. And
so it took us several months to get in. It's going to take 4 months to get the results.
Back.
Of the blood test.
Correct.
That may or may not cost $26,000.
Right. And it might show absolutely nothing. I mean,
which would be an even better way to spend $26,000.
Exactly. And you and I were both like, that's probably
what's going to
happen.
Right.
But it wasn't.
No.
You, of course, were out of town because you seemed to not be around or a weekend when things happen, right?
The rules of comedy always apply.
Yeah. So you're not home, and I get a phone call from the genetic counselor that works with him, and she tells me, I've just emailed you the report, but I'm going to talk to you a little bit about it, and then in a couple weeks, the doctor wants you to come in for even more discussion over it because he needs to do some research in these 2 weeks. So I was like, okay. Research, that means there had to have been something.
Mm-hmm.
So I hadn't even printed out what she had sent me. She's just telling me this. And so she's like, okay, first of all, he has a gene mutation in his, what did they call it? The mitochondrial tests. They were testing for mitochondrial diseases.
Right.
And again, I'm not a science major buff. I don't know a ton, but
You did take geology in college, though.
And probably failed it. But that's a whole nother story.
Okay.
But she was telling me that every cell has mitochondria in it. And when you have a gene mutation of part of your mitochondria, it can affect a whole bunch of stuff. And Cason actually had 2 different gene mutations. She says one of them, they know for sure, is non-disease causing. It's just a mutation. It doesn't affect him. The other one is a known disease-causing mutation.
So one was like your appendix, and the other one was not.
Was not. However, because it's Cason, it has to be difficult.
Sure.
The variant of his particular mutation is unknown in what happens to him symptom-wise and disease-wise.
Well, let's clarify that for everybody. You're talking specifically about chromosome 15.
Nope.
No, you're just
not chromosome 15.
This is literally
his mitochondrial one.
So even broader.
This
exciting.
Is different. Yeah, because remember, they did like 3 or 4 different panels of genetic testing. This was testing for mitochondrial diseases.
Okay.
So he has 2 mutations. One non-disease, one disease.
One disease.
But the variant he has, there's no research to show if it's disease-causing or not. However, if it caused a disease, because there are known diseases with this particular mutation, but not the variant that Cason has. It's kind of complicated.
Right.
Would be neurologic symptoms, metabolic abnormalities, and muscle dysfunction. So those are
all things we were dealing with.
Kind of dealing with.
Yeah.
And so the genetic counselor was like, so see, this could be part of it. Well, I thought that was the end of what they found. And then she was like, but the most interesting thing is they found he has an extremely rare chromosome deletion, unnamed. It's just called 15q25.2.
Now,
yeah,
let's talk about that. It's rare.
Very.
At the time, that was the name, 15q25.2. 10 years later, it has now become known as, it's much more specific. It's 15q25.2 chromosome deletion syndrome.
Correct. Now, how many people did she say had this in 2012?
Well, now, okay, we want to be clear that we don't know. It's not like we're stating this as a fact. What we were told in 2015 was that as of 2012, there had been 9 people worldwide that had been diagnosed with 15q25.2.
Correct. And that in their records, Cason was...
He was number 10.
The 10th.
Okay. Now, I did a little research. The population of the world in 2015 was approximately 7.4 billion people. So when people say, oh, Cason, man, he's 1 in a million. Technically, he's 1 in 740 million. So it's rare.
Very.
Now, what's even weirder is that in doing a little research for this discussion, it's not like there's a lot of information on 15q25.2 chromosomal deletion syndrome, also known as 15.2q25.2 microbial deletion syndrome. Yeah, microdeletion syndrome. According to the one source that I could find that would even state how many cases there may be, it said, and this was dated in October of 2021, that there had been less than 10 cases diagnosed.
Correct.
So
there's more than that.
There has to be more,
but
that's not a lot more.
Not a lot.
Yeah.
It's rare, and nobody knows anything about it.
Well, nobody knows anything much about it.
Yeah. So
I think we know more about it than most people, most scientists.
Yeah. Definitely.
Certainly most doctors.
Yes.
Yeah.
So she said those 9 people that had been diagnosed, this is what they saw in them. They saw mild to moderate intellectual disability, developmental delay.
Check.
Poor growth.
Check.
Anemia. He has that now. He didn't.
Right.
Then.
At the time, we thought we had escaped that one, but yeah.
Cardiac issues.
Yeah. Check.
Muscle tone, muscle issues, and bone issues.
Check and check.
Seizures, autism.
Check.
And neuropsychiatric disorders.
Check.
And an increase in cancer, 2 different kinds of leukemia, and a bone cancer, osteosarcoma.
An increase of chances of getting those things.
Yeah.
Which, so far that has not been an issue, right?
Right. So she's telling me all that, and my first response, I literally start crying my eyes out.
Mm-hmm.
But I wasn't crying because
he was 1 in 740 million?
No, or the fact that she listed a whole wide range of
cancer.
Yeah, it was the fact that I was so dang relieved because at this point, Cason was almost 14.
Right.
So it had been almost 14 years of doctors and medicines and symptoms and all kinds of craziness that after a while, as a parent, you start thinking, what is happening?
Or do I have Munchausen syndrome?
Well, I swear at some point, some doctor is going to be like, he can't have all these issues.
Yeah.
Like, seriously. But it just was the biggest relief because I wasn't crazy. And he's extremely rare. And, oh my gosh, this is great news for us.
It was very surreal to hear that even secondhand because it all sounds very... Scary is not really the word, but it doesn't sound good. You know, if you were feeling singled out for any reason, it was now pretty clear that we were pretty singular in our things that we're dealing with.
Right.
But yeah, at the same time, it was good to know that there was a reason why these things were happening.
Right.
Of course, we found out very quickly one of the problems with there being almost no information on a deletion syndrome is that clearly there's no cure.
There's no cure.
It's not a disease. It's a syndrome.
It's a syndrome.
So we really just treat all the various things going on, but at least we knew what the most likely cause of all of it was.
So then I go in and meet with the geneticist for a long meeting, and he literally goes through the whole report, and it's a big report and very detailed. Most of it is scientific and completely over my head.
Right.
And he explains all this stuff. And he said, I told you there was going to be something on that with his 15th chromosome.
Right.
He goes, but I did not expect this, because he goes, in my 40 years of doing this, never heard of this. He goes, I've spent the last 2 weeks researching this, talking to other geneticists around the country, trying to get more information. He goes, and I have nothing to give you. You already know what I know.
Right.
And he goes, that's not a good place to be. However, I kind of set forth a plan. And he goes, step 1, you need to go back to the cardiologist, and Cason needs to have an MRA done of his heart and chest x-rays.
Mm-hmm.
And that's basically an MRI, but it's like he's in an MRI tube and stuff. This one they did put him completely under because it was a long test. So we know what that means. He couldn't have his meds. Same old thing. He was throwing up for hours and hours. It ended up being an all-day event, but it's looking at the structure of his heart and the blood vessels and all that kind of stuff. Of course, we didn't get results right away. Everyone has to see. So we were wondering, because the geneticist had said those 9 cases that were documented, several of them did have structural issues that needed surgery, and we didn't know at this point. Thankfully, that came back that he did not have any structural damage to his heart.
Right.
So breathing a bit of a sigh of relief with that. Next step, he said, I'm going to get you in to see this doctor who is a mitochondrial specialist who also runs the rare disease clinic here in Dallas. But this is a doctor you can't just call up and make an appointment with. You have to be referred by a specific doctor, and then that doctor has to send all the medical records to this specialist, rare disease doctor, and then his team goes over everything, and they make a determination if they will kind of accept your case or not accept your case. So we kind of were in this waiting time of, are we going to go get in to see him or not? He's very busy. This doctor's extremely busy. So in this waiting time, you happen to be cutting Cason's toenails.
Oh yeah. That in and of itself is probably a 5-minute segment, cutting toenails.
Right.
But
because
yes.
At this point we started noticing that his toes were doing that.
They're kind of curling over.
Curling in, because you went to cut him and his nail bit. Remember how his nails had gotten really thick?
Let's kind of cover that. I mean, it had gotten to the point where cutting Cason's toenails required a mask and a blowtorch.
Yeah.
Because it was so thick. We had to buy, typical clippers would no longer do it. We had to get industrial strength clippers,
which is strange.
And he's very uncomfortable, being touched, feels ticklish, feels all kinds of things. So it's a whole thing. He has to lay down, and I've got to stand up and get just the right angle to get just the right amount of pressure to crack it. And God forbid it clips any skin or cuts too low because he's moving around. But they were very thick. They're still, and they've gotten thicker.
Yeah, and we know why that's coming later.
Right.
But you said, hey, Kim, come look at his toes. And so I come up there and I'm like, that's weird.
Mm-hmm.
You could kind of pull it out from being.
Oh, yeah.
But it was
you could extend it, but
he goes right
it
back.
would just go back. Yeah.
Yeah. And we knew he walked with his feet inwards.
Sort of supinating.
Yeah, kind of. And he'd seen a physical therapist along with an OT, and they've kind of been aware, but no one said anything about his toes. Pediatrician, no one has said anything. So I take him to his normal OT, and the PT happened to be there that day. And I said, hey, can you come do me a favor? I was like, this is weird, but can you look at Cason's feet? And she did, and she's looking, and her eyes kind of get big, and she was like,
She does what most of our therapists do, and that's sort of a,
yeah, this is interesting. And she's like, this is neurological. You need to get this looked at. And I was like, okay, well, that's on the list, knowing that I'm waiting at any day. We're going to find out if we're going to get into this with this rare disease doctor.
Yeah.
I was like, okay, he would be the perfect person to ask. So we end up getting accepted to see him, and it takes a couple more months. So Cason's toes are still like this. And I take him down there, and he comes in with 3 medical students who are all fellows in rare disease genetics. They like love this, and they'd all seen Cason's records, and it was like Christmas Day for them. They come in so excited to see him, to meet him, to look at him, to look at everything, ask me a million questions. And
not every day you get to see a patient who's 1 3/4 billion.
Right.
Right.
They were fascinated by him. And the doctor does his physical and stuff, and he sees Cason's feet, and he looks at me, and he was like, this is a neurological issue. It's a neuromuscular issue. So what we're going to do, I'm going to do extensive blood work.
Nice.
Cason, how many tubes? And he says 20. Cason freaks out.
Wait, we left out something very important. What? I mean, we're now hearing about some more blood testing. Remember, when the genetic testing came back, the doctor told us that the genetics company was so excited about having this new data that they comped the whole thing.
Right.
$26,000 worth of blood work. They didn't even file the insurance. They just said, this is gold.
Done.
So
and then we had to sign consent because they wanted to
share it with everybody.
His information as research and share it. And we're like, absolutely.
I mean, why wouldn't we?
Help
sure.
Another family. So
now getting more blood tests, we're no longer concerned. We're groundbreaking medical
and of course, but when Cason hears 20 tubes, it's a big freak out. And this doctor was like, look, this is how we're going to do it. We're not going to do, you're not going to sit there and we're going to do 1 tube at a time. He goes, we're going to take 1 huge thing of blood, and then we will fill those tubes. So it's not going to be that big of a deal. Surprisingly, Cason handled, I mean, it was a tremendous amount of blood in 1 huge thing.
How big was the tube?
It was
the biggest tube you'd ever seen?
Yeah.
Yeah.
But it was good because it was pretty fast, and he didn't have to wait for them because he hates that, and they changed the tube out. We didn't like that sensation. So he's like, okay, I'm testing for this, looking at all kinds of stuff. Metabolic, because remember, we were talking about that before, that the mitochondrial one can have some metabolic issues, and looking at his kidneys and all kinds of stuff. And he goes, but in the meantime, I'm going to refer you to the neuromuscular clinic, which is part of neurology, but they specialize in neuromuscular, a lot of muscular dystrophy and stuff like that, because Cason's presenting with odd symptoms. Okay. So had no idea what this was going to entail. Get in to see her maybe a month, 2 months later, and she's spoken with the rare disease doctor, and so she's filled in. And of course, her first comment to me is, I know nothing about his genetic deletion. I have no idea. I don't know what symptom is what. I just don't know. And I'm like, I don't either, and neither does this doctor and that doctor. Sure. And she said she does the neurological exam on Cason, and she notices his reflexes were pretty much absent in his lower extremities, and his sensation seemed to be off, which was surprising to me. She watched him walk and noticed, remember we had mentioned before in OT, they were working on his balance and things like that. So she noticed that was a little bit off. His gait was a little bit off. So her next step was to go get nerve testing done. And if you know anything about having your nerves tested, it's not fun.
No, it's not.
And it's extremely painful.
Yeah.
And so she's kind of talking.
And for someone who has a hypersensitivity to all things physical,
right,
it's going to be especially painful.
Right. So she's kind of talking in code, to me because she knows if Cason hears the word painful or anything like that, there's just no way this was going to happen. I was so nervous before this appointment, knowing what was about to happen. But I had to act all normal, and it was fine because I could not show Cason that I was worried. He was nervous about it just because it was a new situation,
Right.
but he had no idea what was coming. And so this is at a children's hospital, so at least they were good in that regard. Now, he's 14. He's over 14. So the techs that were handling this weren't great with the fact that he had autism and all that kind of stuff, because I was having to constantly be like, yes, he is 14, but he's not 14, and these are the issues. And so they're doing the evoked potential nerve tests first, and it kind of sends a electrical shock, and they did it on all extremities, and they weren't getting much of a response at all.
Yeah.
And they were having to move the equipment around. They had Cason put his hands in warm water. They were doing all kinds of stuff, and they still couldn't get it. Cason was getting frustrated. So they go and get...
But he's not frustrated because he can't feel things.
No.
He doesn't know that's what's going on.
Yeah.
He's just frustrated because it's taking too long.
Taking too long.
Yeah.
So they go and get the neuromuscular doctor, who is the partner of the doctor we were seeing. And she comes in and she does this portion of the test, and she's struggling to find what she needs to see. And they finally get enough response to finish that test. And then she was like, okay, now we're moving on to the EMG. That's the extremely painful one. You can't be sedated for it. You can't have numbing cream because they're testing how your nerves and muscles work. And so basically they stick a needle all over your body into different muscles with a little bit of electric shock, and they make you, while the needle's in, tense your muscle, and they're recording stuff. Well, that did not go over well.
I mean, first of all, Cason's going to have a hard time flexing muscles because he has a hard time controlling. I mean, one of the things I'm sure we'll talk about in the future, it took Cason until he was, how old was he before he finally learned how to blow his nose?
Oh my gosh.
He was like 8.
No, more than
10?
Yeah.
Yeah, I mean, he was
not
just
like 13.
Just trying to have the muscle control to isolate. So this had to have been monumentally frustrating for him.
And so painful. And
Yeah.
he was screaming. It was horrible to watch.
Yeah.
They were trying to hold him down. I mean, it was just a horrible situation. But remember, we've mentioned in other podcasts that Cason had the movement disorder, and these genetic issues, they think is kind of what's caused some of that. So that's part of why they were doing this testing. So she's about halfway through with this EMG, and she looks at me and says, has the rare disease doctor mentioned Friedreich's ataxia to you? And I'm, no.
Another new word we haven't heard. Sure.
Yeah, I don't know. And she was like, okay, I'll be right back. And leaves me in there with Cason screaming and some nurses and techs. And she was gone for like 15 minutes. And it was kind of good in the way, got Cason to kind of calm down. And they'd given him like some snack or something to kind of, chill him out. And she comes back in and she says, okay, well, I just called the rare disease doctor to ask him what he thought about this Friedreich's ataxia. Because what she's seen on the screen, this EMG thing, she's like, this is exactly what this would represent. And I said, I don't know, what is it? And she was like, well, it's a neuro degenerative disease, similar to ALS.
Oh,
in the sense
that's
that,
good to hear.
Yeah, and that it presents in early adolescence. And she describes the symptoms, and it's totally Cason.
Right. The
balance issues. I mean, just everything. And I was just like, oh, no, this isn't good. They already suspected maybe Huntington's, which, was a neurodegenerative. And now this one, and she's like, I'm going to finish the test. But I think we need to do a blood test to look for this specific marker. It's a gene. And I said, well, wouldn't that have shown up in the genetic testing? She's like, yes and no. And it's all science stuff. And she's like, but we'll do one more blood test to get a specific, we're looking for something very specific. And she goes, I'll be 2 to 3 weeks to get that back.
Jeez.
So now I'm really nervous because I go home and Google, and that's not a good thing to do.
Well, we've always talked about how I discourage you from Googling, although it's led to your many, representative medical degrees. It also yields a lot of stress because of
what you find.
What you find, yeah.
Yeah. So it was a long 3 weeks. I pretty much convinced myself that's exactly what it was because you read the symptoms.
Friedreich's ataxia.
And that's Cason to a T. Well, surprisingly, he did not have that. So we were relieved, but now there's this huge question mark where in her report, the neuromuscular doctor's report was basically a big old question mark. This kid is presenting with abnormal EMG that looks like this. All his evoked potential nerve testing was abnormal. They found he has neuropathy in all 4 extremities, from the knees down and the elbows down.
And when we heard about that, it sort of explained another odd issue we were having, in that he was going through shoes very quickly.
Right.
Right. And it wasn't because the bottoms of the shoes were wearing off.
Right.
Or the integrity of the shoe was getting messed up from a lot of wear and tear. It was literally the inserts, the insoles, that were just wearing out. So we had the Dr. Scholl's things and cut them and put them in, and he'd just wear through them. And basically the way it was explained to us was because of the neuropathy, he really couldn't, he couldn't feel
the ground.
So he's pushing harder to give him a sense of that he's not walking on air.
Right.
And to just feel like he's literally on the ground. And literally that was wearing his shoes out.
Right. And it also made sense to us that with his balance, because when you don't feel your legs or your feet
or the ground,
your balance is going to be off.
Right.
And we had noticed, like walking down our stairs in our house, he would hold, he's, like I said, he's 14, and it hadn't changed from when he was 5. He would hold on to the railing and take one step at a time, and he watches where he's going. He's constantly looking. And, at the time, we didn't think much of it. But
we just thought he was just really careful.
Really careful. Yeah. But this is why he was doing that. That explains why he didn't have the reflexes.
He was literally watching his feet touch the ground.
Right.
Even though he probably couldn't feel it. And I think what else was interesting about that is that clearly, despite his intellectual shortcomings, he had somehow adapted to life, just as he did with his vision, until we took him to get glasses.
He just kind of compensated.
He just compensated and figured out a way to get by during the day. And whether it was the intellectual shortcomings that prevented him from being able to explain things that were going on, or he just thought, well, I guess this is just things people do, and I'll just figure it out. That was also really interesting, considering all the things he had going on, that he was able to do that.
Right. Yeah. The neuromuscular doctor and the rare disease doctor were kind of surprised by it, actually. Because they were both like, does he fall all the time? And he had when he was younger. Remember, I think we talked about that. And I'm like, he would fall all the time.
Just
accident prone.
Yeah.
But they explained it that that's how his body started to compensate. Like it kind of learned from that, it's interesting. So the next step was that really there are no answers.
Yeah,
and that
the
they're
next
all
step was we're gonna come up with some steps.
We're gonna see you every 3 months. So we were kind of now adding a geneticist, a rare disease specialist, and a neuromuscular doctor.
And by the way, the medical team has gotten real big now.
Yeah. And so if you think about how, like we mentioned in the last episode, how many doctors Cason was seeing on a regular basis, we just added 3 more that was on a continuous loop. And a lot of them worked together. A couple of them didn't, just because they weren't part of the same hospital system, but they were in contact. But nobody knew really what was going on.
Nobody knew everything.
No. And so they all kind of decided, what are we going to do to give Cason the best quality of life? And we're going to just treat symptoms and issues as they come along and kind of throw our hands in the air and guess, is this a symptom of a medicine? Is this the mitochondrial? Is this the 15q? What is the problem?
Yeah.
As the patient, that's hard and very frustrating, because that's why we kind of joke that I became a doctor in multiple fields, because I ended up doing so much research and trying to help these doctors, which is...
Because, again, all the doctors were primarily concerned about their field of study.
Correct.
If it was the cardiologist, they were concerned about the heart. And whatever anyone else was saying would be secondary to what they thought. So, again, our psychiatrist is kind of running point, but we're having differing opinions about how things should be done, continuing to be warned about the possible side effects or long-term effects of the medicine he was taking.
Yeah. So the neuromuscular doctor said, I think you need to go see our orthotics guy, because
The orthotics guy. Yeah.
Cason's toes and the fact that his feet were kind of turned in, and that he had lost range of motion, so he was not able to flex his feet like that. And
Up.
Yeah. And so she was like, he's great. Cason's going to love him. He works with a lot of our kids. And
Cason's going to love the orthotics guy.
The guy, not the orthotics.
He won't love the orthotics.
No.
Right.
So we go, and of course I'm trying to explain to Cason, okay, this is what they're going to do. Well, they cast him to make the mold.
Yeah.
That Cason didn't.
That was received poorly.
Very poorly.
Right.
And I was trying to explain to him, and so was the orthotics guy, what these orthotics are going to look like. He was to wear them every night.
How long was he supposed to wear them?
What?
Well, we were, like everything else, we were going to be ramping it up, right? It was supposed to start at like half an hour or something. We were going to add time and eventually get to
all night
long.
Right.
We never made it.
No. Because we go, it took a couple weeks or maybe a month. I don't even remember how long it takes to got his orthotics back. And Cason got to design them. He picked the colors out. They were really cool.
Like everything else, they were blue and red, and they,
Yeah, they were really cool. Until
yeah.
Cason saw how huge they were. It's kind of like like
when you ski boot.
Yeah, like when you break your foot in one of those, but it was missing the top part.
Right.
And Cason took one look at that, and I'm not going to wear that. And
classic Cason.
Mm-hmm.
Right.
And it became this whole back and forth with the orthotics guy. Let's just try it on. I have to maybe shave a little of it off. I want it to fit your foot perfectly.
Just getting him, and again, it didn't help that he couldn't feel.
Right.
He couldn't feel the end of the boot or whatever. So just even getting him to put his foot in there, because it was like, we still run into this problem now when we're like wrapping his ankles when he plays sports or whatever. We'd get it in there and I'd tighten it all up, and then he'd go, oh, something's wrong. It feels weird. Which we just thought, well, that's just the way it feels. But then we would see, oh yeah, he hasn't flattened his foot to the bottom. So we'd have to like physically push his heel down in there.
Yeah.
So that it would get into that little, it was a fitted boot basically, but he would not have put it all the way in there. So just literally even getting him into the braces took time and effort.
Right.
Exertion.
And once he had them on, we had to do it in his bed because he couldn't walk on them.
No, he couldn't.
You can't walk in them.
Well,
he kind of
he definitely could not.
No.
I mean, anyone would struggle because you can't bend.
you can't bend, but
But it'd be like walking in ski boots, but he was basically immobilized.
right.
Yeah. Just
So-
didn't have the ability, it just didn't have the dexterity to figure out how to even make it work.
No. So we said, okay, we're going to just do it for 10 minutes.
Just to try and stretch those muscles a little bit.
Right.
Yep.
Couldn't handle it. He hated everything about it. He hated the sensation of the boot. He hated the fact, and it hurt. I mean, it was painful.
Because
we
it's
tried
stretching those muscles.
Stretching those muscles. We tried and we tried and we bribed and we did all kinds of stuff. And finally, I email the nurse at the neuromuscular clinic, and I'm like, okay, this is not going to work. And I said, look, we have so many battles to fight with him on a daily basis. This is one we just can't do.
Yeah.
He needs to sleep.
He could not sleep
with those on.
And it's funny because Cason does not move around a lot when he sleeps. He pretty much sleeps on his back and he's just like a mummy. But so you would think, oh, well, then it won't really bother him because he's not moving around or laying sideways or anything.
He couldn't do it.
But he could not do it.
No.
I think the longest he had him on, I think we got to half an hour a couple times. But he is asking the entire time.
They get him off.
Was it almost time?
Right.
Can we take him off? Yeah.
Right. So they agreed. This is just not a battle worth fighting right now, because obviously if he doesn't sleep, then we have a lot of problems mood-wise, and that's just not important. So they gave us stretches to do. Remember that wedge things? But we were supposed to do that. And again, we're not physical therapists or occupational therapists, so we try.
Mm-hmm.
It doesn't go over well.
No.
Cason fights.
As you say, pick your battles.
Pick your battles.
Mm-hmm.
So we transferred that to the OT and the PT, and we're like, okay, you guys focus on that.
When he is here twice a week,
you do that. So they did the stretches, and they really started working on his fine motor, because about this time, we start noticing he's dropping everything and struggling. And he's always struggled with fine motor, but it got to the point, like, he was having so much trouble picking up his medicine pills.
A glass.
He couldn't do
food.
Yeah, he couldn't do Legos anymore.
Yeah, and that was hard on him, because that's the one thing, and we haven't talked about that, but he always liked Legos, and he wanted me to help him out, but he was surprisingly he was pretty good at following the instructions and stuff. Generally, I'd have to go in because he'd missed a step or something, and I'd kind of repair it. But he had gotten to the point where he literally either he would push too hard and it would break it all, or he couldn't figure out how to line it up
or pick it,
or just even pick it up. And when you're dealing with some of those really small ones, I mean, he was
so frustrated,
getting mad. Yeah,
so frustrated about it. So we go back to the neuromuscular, and I am explaining what we're seeing. Mentioned to her that along with him dropping everything, he starts complaining about his feet hurting and his legs hurting, which he had done on and off for quite a while prior to us knowing that he had neuropathy.
Right.
But this is Cason too, and he was super hyper and he's running around and stuff. It's hard to know why his feet were hurting. But it didn't ever stop him from doing anything. But now it was stopping him from doing things. Like, he would be at the grocery store with me, and we'd be there 5 minutes, and he's complaining that his feet hurt, that he needs to sit down, that he needs to stop. There were several times where I'd have to just leave because he has to sit down. There's not a place to sit down. He was struggling more, like at recess. We were just hearing him talk more and more about it. So when I take him back to the neuromuscular doctor and talk about the hands are not working right and his feet are hurting so much, she's like, well, that's the neuropathy and it's kind of progressing some. So we need to put him on medicine to help with that.
More medicine.
Mm-hmm. And this one's gabapentin, which is used to treat neuropathy, help the pain.
Among other pain things.
Yeah, but it can also be used as a mood stabilizer sometimes. So we had to talk to our psychiatrist about, okay, he needs this. How is this going to affect the lithium and the clozaril? Because at this point, we had really gotten to a decent dose on both of those, and Cason's mood was better. His hallucinations were much, much, much better. But adding another medicine to what the ton he was already taking was kind of nerve-wracking, but we really didn't have a choice at this point because he's suffering. So we started on a low dose of gabapentin and slowly increased it. Supposed to be a sedating medicine. Didn't phase him like
it did not appear to sedate him.
Any of the meds. Nothing sedates that boy. So because of this, she then says we need to get a sleep study done because neuropathy can affect breathing. We need to get a swallow study.
So he might now have sleep apnea.
Might have sleep apnea. Yeah. We need a swallow study done. Just because that's one of the things that when we do talk to civilians who aren't in the mental health army, when you talk about doing a swallow study, talk about something people are like, what? You can study how he swallows? Yes, exactly. Mm-hmm. That's what we're doing because, again, we talked about, or did we talk about how when he eats like a burger, he loves burgers, right? But if it's the meat has to be thin.
He has an exceptionally small mouth, which we'll talk about dental work when that's another fun story with all the extra teeth he had. But essentially, he couldn't chew and or swallow. So we had to, swallow.
We didn't know at the time. Some of that, we were like, oh, that's sensory issue type
right.
stuff.
Yes, because that was the first diagnosis we got, was sensory integration. Right. So we were still thinking that was just sensory. But like the texture of the food.
Right. But come to find out, they did the swallow study, which is a speech pathologist does it in front of an x-ray, and they watch him chew
swallow,
and drink certain things. And sure enough, he has what they call mild dysphagia, which is it's slowing of him swallowing. And it was noted he has a very small palate.
It's the tiniest palate I've ever seen.
He has a very small mouth, very small tongue too, which again, they were like, this could go back to the 15Q stuff,
That's when the doctor says, okay, say ah. I mean, they have to really, really heighten up to see anywhere close to his throat. And he can't flatten his tongue. He can't
move
his tongue out.
From side to side.
His tongue is essentially immobile.
Right.
Yeah.
It's weird. And so when he gets food stuck over here, he can't.
He does this.
Yeah, he pushes it. He can't use his tongue to do it. And so this particular speech pathologist had given us, okay, make sure he chews this amount of time, make sure his food's cut small, make sure,
and we're listening to that going, okay, food cut small, that's one thing, but making sure he's chewing a certain amount of times, that's just not going to happen.
No. Okay. It's not going to happen. Cason, let's count, he's not.
Count to 30.
And then, of course, she's like, harder things to chew. If he says it's hard to chew, obviously don't chew and swallow. Don't make him eat it,
right.
Which we don't, which is fine. So make an appointment with the sleep doctor, and I send you on your way to that because at this point in 14 years, let's just be honest.
Yeah, okay.
He's done all the testing.
We don't need to do no one's keeping score here.
So I sent you to the overnight.
Right. So I did the overnight. With Cason. So when we got to the sleep doctor and they were explaining, he's got a million questions. And going over there is like, what do I have to do? Is there shots? Is it going to hurt? And I'm like, no, you just sleep. Which was easier said than done because, first of all, he didn't like wearing all the stuff. And, they had to come in and they put the electrodes, but it's the like putty type stuff to stick them to his head. And he's got things on his fingers and that's all bothering him. And so I was...
Did they let you stay in the room with them? I can't remember. They did? Okay.
Yeah, they let me stay in the room with them.
They made you
they said I could sleep in another room, and I was like, until he's asleep, there's no point in me trying to do that. So we went in, and I was sitting in a recliner type chair. But he eventually did go to sleep. And of course, he was having apneas.
A lot
So
of apneas.
yeah,
Like stopping breathing. It was like, oh, no, I can't remember the number, but it was
60, 70 times a minute.
Yeah,
It was
it
a lot.
was a significant
Yeah.
amount.
So of course, when we go back to get the equipment, you know, they've got the full face mask, they've got the little sort of under your nose mask, and generally people like the smaller, you know, masks and stuff. Cason had to have the full face mask.
Yeah.
Because
And partly because why? He couldn't coordinate his breathing to breathe only through his nose,
Right.
not his mouth.
And
He struggled. He could not figure that.
he could not figure out how to just breathe through his nose, so we had to put the full face mask on. He said he wasn't going to be able to do it. He'd never be able to do it. And, you know, just like anyone with sleep apnea, he now can't sleep without it. But like everything else, it was a struggle. And another thing we could just add to his dossier of things that he had going on was the sleep apnea.
Yes.
So, yeah.
And then, because of the neuropathy, it can affect your optic nerve. So, and we have already said, he has horrible vision.
He is
horrible.
He's been legally blind
for
a long time.
But they now required him to go every 6 months just to make sure that his optic nerve was not being involved in that.
Yeah.
And so far, so good on that.
And he still has to get a new prescription every 6 months. But
yeah, he does have to do that, but it's not affecting his optic nerve. So at this point, as you can tell, we have added medicine, more diagnosis, more doctors, more equipment. It just seems like it's a never-ending thing with him. But at the same time, like we've said, these doctors, no one has answers for us, and they're all guessing.
Yeah. And again, a lot of stuff wasn't covered by insurance because, you know, insurance typically tends to cover things that are more common with people. So when nobody knows what 15q25 is, and you're saying, well, we have to do this because of a chromosomal deletion, they're like, that's not covered. You know, we're not going to cover orthotics. He doesn't need orthotics. He doesn't. So we're running through all that.
With this neuropathy, so lithium, long-term use of lithium can cause neuropathy. So we were like, and a psychiatrist was like, is this because of the lithium? Well, when he did the EMG test, that neuromuscular doctor was like, no, because lithium neuropathy presents differently than this. His is more neuromuscular disease-like. But when I would ask them how much worse is this going to get, what's going to happen in the future, they have no idea.
No, they have no idea.
Well,
and that's where we were getting the things like, depending on the doctor we would talk to, they'd say, you know, prolonged use of this medicine is going to damage the organ, which could lead to a shorter lifespan.
Right.
You know? And again, we're like, well, I mean, what are we going to do?
Right.
You know, I mean, we can't stop taking it because it'll lead to other issues. And
right.
So we had to, again, it was just a continual reminder that we were functioning and are continuing to focus on quality of life over quantity of life. Because, I mean, if you don't even have doctors, specialists who can say anything to you other than, look, if he just continues to take this, he could have a shorter life. And you come back and say, well, if he doesn't take this, these things are going to happen. They're like, well, I see where you're coming from.
And they're all on board with it.
Sure. Yeah. No one has questioned us ethically or anything.
No,
like that,
they all understand, but they're frustrated themselves that they can't. And we'll get into this later, but now that Cason's almost 23, we, except for 2 doctors, really, we have, you know, started over with adult doctors. And so we've kind of started the whole thing over again where which
that's going to be a whole topic, I think, once we get past
them not understanding anything, them really focusing on
converting from pediatric physicians to adult physicians when you have a child with special needs we'll focus on that. Yeah.
Whole nother deal. Okay, so he has mild dysphagia.
So what age
We're
as we kind of end this part of the story, we're what, 15 and a half?
He's about 15 and a half because in about this time, remember we had mentioned in the last episode that he was sent to see an immunologist because he was getting sick a lot and he had pneumonia, and that all of his immune markers were low.
Mm-hmm.
Come to find out, the geneticist did think his 15q did play a role in that, or does play a role in that.
Right.
So about this time, Cason starts getting repeated sinus infections, like non-stop sinus infections. It didn't ever turn into pneumonia or anything, but he was on antibiotics constantly.
It felt like he would be like on them and off them every 6 weeks.
Right. So we go see it.
And they're starting to get concerned he's going to get immune to antibiotics.
So we go see a different allergist immunologist, and they suggest the skin prick test. And I finally, I kind of had to put my foot down on that one and say, no,
there's got to be another way.
And after I explained everything to them, they agreed that this poor kid has had so much testing and...
Well, just throw all that out. He just won't handle that.
He wouldn't handle it. And I didn't want
the word skin prick will shoot him over the edge.
Especially since he's had this EMG and the extreme pain in that.
And the nerve testing, yeah.
Because they agreed that you can do a blood test. It shows similar stuff. Let's see what he's allergic to, and then maybe we can do allergy shots. And I'm like, no, we can't add allergy shots at this point. I mean, he's getting all this blood work all the time. He's taking all this medicine. I cannot,
in good conscience,
start allergy shots with him. And him getting right now, at this age, and how he was acting all the time. I just know. And he hears the word shot, and no way.
Yeah, he's very averse.
He's not going to do it. He's not going to do it. So we get the results of that back, and sure enough, he's allergic to all kinds of stuff. And so they put him on an allergy regimen. So he's taking prescription allergy medicine, and then that's when we did the breathing. He had this breathing machine.
Well, that's the albuterol, right?
The budesonide.
The budesonide. And he had to do that 10 minutes a night.
Yeah.
And it was really loud. It was super loud. The mask was uncomfortable. He hated that. Yeah. So we were doing that too.
We did that for quite a while. And it helped. And this whole allergy regimen helped.
It did not hurt.
It lessened the amount of sinus infections. But they're noting, because when they did the blood test, at this point, his 2 out of the 3 immune markers were now below normal.
Mm-hmm.
They were low normal. They're now below normal, which is not good.
Yeah.
And so they're like, we're just going to monitor him.
Keep an eye on this.
We're going to keep an eye on this. So then we add going to the allergist. We were seeing the immunologist maybe every 6 months. Now they wanted to see him like every 2, maybe 3 months. And they were checking his immune markers. They were checking his breathing. They were checking all kinds of stuff. So at this point, I am living my life either in a hospital or a doctor's office. Same with Cason. It is nonstop between the blood work, the appointments, the pharmacy. I mean, it was just constant.
It was like a tour.
Yeah.
It was like being a rock band on tour. You had certain stops that you made every week, every other week, every month. We're getting so much medication. We're going to the pharmacy every 2 days.
Yeah.
We've always talked about, there was a period of time where it seemed like everything was kind of on the same refill day.
Yeah.
And then that quickly all goes to hell.
And you're visiting a place a lot when the valet at the hospital knows you and your son, when the pharmacist and all the techs know you by name. Like, you just pull up and they're like, hey, Mrs. Cribbs.
Well, prior to our insurance changing, we were getting prescriptions filled at CVS pharmacy. And before their contract expired.
It was when we switched to Clozaril.
Yeah.
Prior
to that, we got a card at the end of the year from CVS thanking us for being one of their top 10 clients.
Yeah.
It was just a local store, but
that's sad.
I felt really weird about that.
Yeah.
Yeah.
Yeah. And it's
Thanks
like
so
that.
much for your
In
business.
every pharmacy we've been to since, they all like everybody knows us. You just walk by and they like, "Hey Kim, how's
Got something for Cason?
Cason?" Yeah. Like I said, the valet, just everybody knows you. That you walk into the blood test center and they're like, "Oh,
Hey, there's Cason.
yeah." And now we've been doing this long enough that we go to different, labs around.
Have moved around.
And the techs are like, "Oh, I did your blood test 5 years
I
ago."
know the when you were 6.
Yeah,
and
and
you yelled and screamed.
Yeah, and that's just kind of a sad life that many.
It's funny at the time. You laugh and say, but then you go get in the car and you're like,
Yeah, that's kind of
weird.
that is very.
So let's go over all the, just for everyone's edification here. By 15 and a half, 16.
He's about 15 and a half.
So let's go over all the designated diagnoses he has at this point, starting back with sensory integration disorder, SID.
Yeah, so we started with
That was the first one.
Mm-hmm.
PDDNOS was next.
Mm-hmm.
Pervasive developmental disorder not otherwise specified.
Mm-hmm. Yeah.
Well, they don't do that anymore.
No, it's autism.
It's autism. So then was next dyslexia, dysgraphia. Is that kind of next? Okay, so we get bipolar disorder 2, bipolar disorder 2,
I think
right?
2, yeah.
So that's 5.
Movement disorder, tic disorder.
Flash Tourette's, yeah. So that's 6. Then we had. Then did we have a little break?
We might have had a little break
before we got into schizoaffective.
Got schizoaffective.
And then we get a whole bunch.
Well, we got the autism. It was switched to
Well, then switch it to autism.
Then it was schizoaffective.
And we get the schizoaffective disorder.
Then his IQ start dropping.
And what would it be? Just a
that was just
intellectual capacity.
At that point, yeah, they were like just lowered.
Right, just
lowered.
Developmental brain disorder, something.
Developmental brain.
Not otherwise specified. And then we get
the genetic
testing, which tells us we have 15q25.2, also known as chromosomal deletion syndrome. That leads to the
neuropathy.
The neuropathy and
then he gets the sleep apnea.
The sleep apnea, allergies.
The dysphagia.
Dysphagia, we're starting to probably hear that there's probably some sort of immune disorder. We don't know what it is yet, so that's not diagnosed. Does that put us at 10? That's 10?
I lost count. That's a lot.
Yeah, we're only 15 and a half.
Right.
So we got 8 years to go. We're 2/3 of the way through Cason's life, and we're already in double-digit diagnosis.
And at this point, he needs another neuropsych eval for the school. Those 3 years seem to
they fly by.
And same neuropsychologist is doing it, and it was nice to hear her say how much better he was when it came to his hallucinations and his ability to have somewhat of a conversation. He was engaged with her. She said those 3 years made a huge difference in, I was the whole time I'm like, it's because of Dr. T and the medicine and the Clozaril really, really helped him. But that report showed he now for sure has an intellectual disability. His IQ dropped below that threshold. Even though we knew, because we live with him and he's 15 and a half and he doesn't act 15 and a half and he can't do things that 15-year-olds can do. Reading, writing, all that kind of stuff, just in general. So it wasn't that much of a shock to us. But to see it again on paper and for her to say, okay, his IQ started at above average and now he's
here now
below average.
Yes. Which was a nice way of putting it.
Yeah, nice way of putting it.
But I think the crux of all of this is that this was definitely a period, this 3-year period of his life, we had a glut of discovery, new diagnoses, new protocols, new medicines. It seemed to be a golden age of discovery for us. And I think the most important thing was, again, the reassurance that for anyone who's a fan of House MD, the show that was on Fox 10 to 20 years ago, we no longer had to worry about feeling like we were bad parents or that you were crazy, because we could have taken it to his team and they wouldn't.
Hal would not have even known what to do.
And he knew everything.
He knew everything.
And he would not have known what this was.
Yeah, no. And it was validating too, because the 15Q25, says mild to moderate, some severe intellectual disability. And that kind of went along with what this neuropsychologist has been telling us. Remember, because the last episode we talked about how she's like, for some reason, it's like that one side of his brain just kind of petered out.
Yeah.
And she's like, I haven't seen that. And that's why she referred us to the geneticist. So it's kind of like we go full circle back to that, where I'm like, okay, there's a reason that this is.
Well, and the good news is now we've got it all figured out.
Right.
Oh, hold on.
Yeah, we don't.
There's more to
Because
come.
now at this point, he's 15 and a half, and we, like you just said, we have all these discoveries, and this is kind of where we enter the next phase of Cason's.
While everyone else is getting their driver's license, we're unclogging toilets and
Washing
figure out.
every night because he's still wetting the bed.
Washing sheets every night because he's still wetting the bed.
Yeah.
That's a good point. Yeah, we're still wetting the bed. So there's a lot more to come. We're 2/3 of the way through.
Yep.
That concludes episode 7, Paging Dr. House. So we'll see you next week. I'm Jeff.
And I'm Kim.
And that's Specialness. Thanks for joining us.